to serve you and a lot from this webinar. Today you're going to hear from 3 of us about different workforce resources that are available to you, as well as different considerations for planning and your recruitment process. Now, I know folks on the phone have a range of experiences. Even those that were recently funded, some of you had existing operations, some of you had been lookalike, some of you are brand new. I know we also have some primary care associations on the phone. You can get something from today. We will have our contact up here, and as Maria mentioned, the handouts with all of our contact information are available for you to download in your right-hand attachments bar. So please feel free to check all that out and get in touch with us today, tomorrow, whenever it's convenient for you to talk about things. So I'm going to just jump right in, and I'm going to keep it fast, going to keep it peppy. I know it's the post-lunch time, but if you have any questions or if I am going a little too speedy, please feel free to let us know. So I'm speaking to you from the Association of Clinicians Served in reference to our STAR Center project. So the Solutions, Training, and Assistance for Recruitment and Retention Center, it's a mouthful, so I shortened it to STAR Center. That is our project funded through the Bureau of Primary Health Care to support all community health centers with their recruitment and clinician challenges. So our project page is at chcworkforce.org. If you only take one thing from me today, I hope that's what you take, is that website. We have lots and lots of resources there. You can check out our trainings calendar. You can get in touch with us. Please visit that site and click around a little bit to learn more about us. We, as I said, do resources, training, and technical assistance for free for health centers. I said it once, I'll say it again, it's free. Actually, what happens is that the Bureau of Primary Health Care funds a group of us national organizations to help you as health centers with specific projects. So there's a whole group of us national groups, national cooperative agreements as well. And so we're the Workforce Training and Technical Assistance National Cooperative Agreement. So, say it again, free. We're here to help you with whatever your challenges may be, no matter what kind of range or issue you are with your health center journey. So we do a variety of things. The first is always partnerships. So that's partnerships with primary care associations in your state, the primary care office in your state, and with the Bureau of Primary Health Care. If you don't know who your PCA or your PCO is, or who you should talk to there to kind of learn more about what workforce initiatives are going on in your state, a shout. We will make sure that you're connected with everyone that you need to be connected with. We see ourselves as sort of one cog in the big workforce machine. As you all know, hiring and retaining clinical staff is always a challenge, and it's always part of so many different kinds of health center operations. And so there's lots of different state and national initiatives to help everybody with all those different kinds of things. So we really see ourselves as kind of being a vessel that a lot of different kind of information can flow through, and as being supportive of any state initiatives that are going on. So in terms of actual things that you can access today, I would direct you to this. This is a screenshot of our resource center, chcworkforce.org. I myself used to recruit for health centers, and when I started, I didn't know anything, and I didn't know where I could find anything. And so that's why we put this together. This is kind of your one-stop shop for anything and everything recruitment retention related. So we have about 150 different resources from about 65 different organizations currently housed in the Resource Center, and that's growing every week. As you can see on the screen, you can sort by topic, you can sort by content type, you can see everything we've got, you can search for anything that we have in the top right. Anytime that you're looking for a workforce resource, like, hey, I wonder what should go on an onboarding checklist, or I wonder what tips somebody might have for hiring dental staff, oral health staff. All of that stuff is here. So please come and check it out next time you're looking for something. We want to save you the time of having to create your own stuff when so many great resources already exist. So come look for it here. If you can't find us, just hit that Contact Us button at the top and shoot us a note and say, hey, I really need to find this kind of resource. And that's what we're here for. We will come find that for you. Again, for whatever things you're doing, if you're setting up a workforce program or you just want to refine what you already have that's working, we're here to help you with those resources. I'd also direct your attention to the very bottom in the little blue bar there in the center. You can see self-assessment tool. So this is ACU created in partnership with Pamela, who's on the phone and you're going to hear from next, and her team. And it's a look at the kind of qualitative aspects of what's going on with workforce at your health center. So it's got about 25 to 30 questions on it and asks you all kinds of things, like when was the last time you talked about workforce at a strategic planning level, and what does your recruitment plan look like, and are you using the state loan repayment programs? A whole range. We recommend that you take it as a group, sort of within your own health center. Sit down with your leadership team, all the different people who touch recruitment and retention, and take it to it's a great sense to get everyone on the same track with what's happening, and also a good chance for you as a group to identify where are some pressure points that you could really make an impact on to improve your workforce. We also do, in terms of resources, what you see here is an individual recruitment and retention data profile. So for every health center and lookalike, we do this data profile that looks at about 10 different national data sets. And we say, okay, kind of who are you as a health center in terms of all of this data and all of these aspects that could affect recruitment and retention, and how do you look kind of compared to other health centers? So we have these currently for all the health centers and lookalike who completed 2013 UDS. We'll be doing them again with 2014 UDS data and ongoing in the future. So you may not have one right now, but you certainly will as you continue on with the health center program. Here's just a look at some of the national benchmarking that we did. For each of these data points, there's a benchmark here that shows you kind of where health centers fall. So even if you don't have an individual profile, you can look at this data profile user guide, also available from our resources page of our website, to see, okay, what do a lot of health centers look like right now? And as I get more data and as I look at our operations, where do we fit? We also do regional trainings. You know, I don't love comparing what we do to, I'll do it for the sake of a good visual. Well, we do regional training, state and regional trainings in concert with Primary Care Association conferences. So basically everybody needs one thing, that's some training, that's Coke, but some people need different things. Some people need Diet Coke, and some people need Coke Zero, and some people need Coke Classic. So we tailor it based on what we know about your health centers from the data. And then we also make sure it has your individual name on it based on your input before the training, so that it's something really applicable to you and you can walk away with some ideas from your other health centers and from us about how you can improve your workforce programs. We also provide free technical assistance. That's phone, that's email. We have a limited pot of money for some on-site technical assistance centers of highest need. And so, you know, all you need to do is call us, email us. You can, we'll make sure you have our contact information. You can call me or Mariah here at the STAR Center. You can email us. You can request technical assistance from our website. All of that's available to you. Essentially, we'll talk you through any of the problems you have, challenges that you want to discuss, provide you with resources, connect you with a consultant that we pay for so that you can talk to somebody with more specific expertise. So again, all of this is free because the Bureau of Primary Health Care has essentially paid for it up front. So please make sure that you're taking advantage of the things that are already available to you today, and they will continue to be available to you. In terms of how to get started, you can do one or all of these 4 things. Again, we really want you to visit that chcworkforce.org website, and we want you to explore that resource center, see what's there, see what's missing, see what you need. Take that self-assessment tool with your team, or even just on your own to say, okay, where am I and what's happening, and where can I get started? You can do all of that but also just call us, email us. We are here to serve you. We're here to be helpful. We're here to talk you through kind of your own challenges and how we can make some immediate impacts at your health center. So here's my direct contact information as well as our general STAR Center contact information. Again, this is available in the slides in your attachments box to the right. And again, all of this is at chcworkforce.org. So we're excited to work with you, and we're so glad that you were here today. And I'm going to wrap it up because I know what you really want to hear is from Pamela and Michelle about specific strategic planning and recruitment process stuff. So thanks you all so much for your time. I'm going to now pass it over to Pamela.
Hopefully.
And yeah, I was about to say, here we go.
I'm here. Let's see if we can I move slides yet?
You should be able to. Give it a go.
They don't seem to be going anywhere. Let me click on it and see if that works. Nope.
Nope. Okay.
Nope. There we go. While we're trying to figure that out, there we go. Let's see if I can get it back now. No.
Okay, Pamela, I can advance them for you.
Can you go back then?
Yep.
Thank you. Hi, everybody. This is Pamela Burns with John Snow, and I'm thrilled to be here. First of all, as Allison said, congratulations. I've spent many years, decades actually, working with you folks out in the community in the hopes of being able to help you become supported through the Health Center program and Section 330 funding. So congratulations. It's a highly competitive process, and we really do admire and honor you for having succeeded so far. But now the fun really begins. And I'm going to talk about strategic planning and its interaction with recruitment and retention. As Peter Drucker, famous economist, once said, if you don't know where you're going, any road will get you there. Any road will get you there. I think I just paraphrased it, but truly, strategic planning in the most global sense is about setting a path, about looking to where you are now, where you want to be in the future, and exactly how it is that you're going to get there. All too often, unfortunately, the staffing side of the whole strategic plan has not necessarily been a parallel activity. I always talk about you need substantive strategic planning that is partnered with financial strategic planning that is partnered with recruitment and staffing in general strategic planning, and that includes retention as well as recruitment. So what we're going to just talk about and really briefly overview right now is thinking about strategic planning from that global position of how do you get your whole health center to serve the mission, be responsive to the community and the changes in the environment, and grow in the direction you want. So what you're really looking at is the two aspects of strategic planning are your opportunities and your challenges, and within each of them are internal opportunities and challenges and your external opportunities and challenges. We're going to try the next slide. There we go. So again, it's establishing a roadmap. What's happening in the community, what's happening in the organization, and what's happening in the broader environment, and how do we manage those phenomenon in order to move in the direction that allows us to fulfill our present mission, but also constantly progress toward the thing, the place, the organization that we want to be 5 years from now, 10 years from now. Next, please. So first of all, let's look at what's happening in the community. For those of you out there, and I'm not really sure who you are, you may know me and know that I really believe that the root of everything is in your community needs assessment. in building your program based on the disparities, access, and barrier issues and characteristics of your community. So as part of the planning, as ground basis of the strategic planning is to be looking at the community, and doing a needs assessment is an ongoing process. It's not an event. That's the same thing as recruitment is an ongoing, of staff is not an event, and recruitment of board members is an ongoing process, not an event. So we're constantly trying to feel the pulse of the community so that we can figure out what services should we be offering, how do they need to be delivered, who are the best types of providers and staff to deliver those services in the most effective way and efficient way possible to produce the best outcomes of reducing disparities, increasing access, and eliminating barriers. That's what our overall mission is as health centers. So when we're doing that, we're asking ourselves how many of what kinds of staff and providers, and notice I'm saying staff because it isn't just providers. There are times in your growth pattern that you're going to be needing to look 2 years down the pike. We're going to grow enough so that we're going to need a full-time CFO, for example. Or we're going to grow so much that we're really going to need to increase our front office staff or our backroom staff, or we're going to have to add a COO. So although certainly recruiting providers is critically important, it's also important to look just beyond that and look at your whole organization and what are their needs going to be. So the first thing, what's happening in the community, what kinds of services, how much of them, where should we deliver them, in what kinds of ways should they be delivered, what are the languages, the cultural backgrounds, is a change occurring in the community? Should I start looking now for those nurse practitioners who are bilingual in, I don't know, Thai and English, or Tagalog and English, or whatever the language is that is being spoken by people that you're now realizing are coming into your communities, or the aging, or the in and out migration. Next slide, please. The second thing to be looking at is what's happening inside the organization. What does the present staffing profile look like? Up against the existing services. This is the internal check on your opportunities and challenges. Where might your organization be presently challenged based on trying to meet its mission, the volume and types of services, the outreach that you need, again, the important language and cultural competencies. Does your present staff fit with what it is that your mission tells you you need to be doing? And then, of course, looking as you go into the future, really, what are those age profiles? Where are the areas of expertise? When you look to what you want to accomplish over the next 3 to 5 years, do you have turnover that's going to occur in the areas that you need strength? Do you have a weakness or a challenge in meeting the growth in a certain type of service, a certain kind of departmental function? Are you going to be able to create those opportunities to fill the gaps or to move forward into the future from internal options, training, grow your own? Or are you going to have to really look for external options, developing that external recruitment plan as opposed to an internal development plan, staff development or talent development, as we heard someone call it, and be able to fill them from inside? So again, it's how many of what kinds of staff are we going to need and how are we going to get them? Next slide, please. So when looking internal to the organization, aside from doing just the, not just, but doing the profile of your present staffing and how well does it match with your existing need and your future vision of what services and volume and community you're going to be serving, also looking at, are you regularly doing staff satisfaction? Are you making sure that you're keeping your staff happy and that the areas of importance to them are being focused on by you as well? We all know retention is a lot less expensive than recruitment. Are you creating opportunities for individuals in your organization to achieve their personal goals, therefore career ladders. Is there a way that you're tracking, are you on target with other potential employers in the community as far as being able to remain attractive to your staff? And that's intangible as well as tangible benefits that you can offer them. Next slide, please. And if I know I'm going fast, folks, if you have questions, please do post them. I don't know that we said that, but you can do that over there, I think, in that box on the right. And again, what kinds of who and what will we need and when will we need them, so that you have set a very concrete plan for ensuring that your goals can be met from a staffing perspective as well as that financial support perspective, and actually reaching out into the community. Next slide, please. And then finally, what's happening in the environment? What kinds of changes? The Affordable Care Act, changes that are going on in going from volume payment to value-based payment. How is that going to impact your ability as an organization to deliver the volume and types of services that your needs assessment and your mission tell you that you're going to want to be able to produce over the next 3 to 5 years? How is that going to impact your ability to offer compensation packages? Do you need to change your recruitment plan? Do you need to focus on different kinds of providers or different kinds of staff because of the nature of the policy and reimbursement changes going on? Has your state broadened the scope of advanced practice nurse practitioners or physician assistants so that they're more able to be utilized in your organization for a broader set of services, and therefore a more attractive option for you to be looking at in terms of broadening your recruitment strategies, or growing your own from within by providing training and education support to people who are RNs, for example, to actually go on with their education and become APRNs. And big thing that's happening all around that you really have to pay attention to is the market competition changes that are occurring. We're finding that larger institutions, hospital-based, larger healthcare institutions are literally gobbling up primary care practices and offering compensation packages to new providers coming out that are very challenging for a lot of health centers to be able to match. So it's really important to be monitoring that on an ongoing basis and creating a plan, an ongoing plan for growing your benefits, and again, not just financial benefits, but those intangibles that make you more attractive to potential new recruits. And again, not just providers, but thinking of it a little bit more globally. Next slide, please. Where do you want to go? 10 years from now, what do you want to be? How are you going to get there? If your strategic plan calls for growth, you have to have a strategic recruitment and growth plan as well. And again, you can grow your own and you can bring them in. But finding the appropriate balance and having the dedicated resources to do those things are critically important at the very outset of setting your strategic goals for the future. Next and final slide. So remember, whenever you're doing strategic planning, whether it be programmatic, financial, or staffing model, that you want to make sure that you have SMART goals, that they're specific, who do you need, that they're measurable, how many of them do you need, they're attainable, can we really get them, they're realistic, that your organization is willing to dedicate the resources that are going to be needed in order to particularly grow your own, and you can tell I'm a big fan of grow your own, but supporting further education for existing staff is money well spent, in my opinion, and time framed, that you have very concrete, operationalized action steps. You know who's responsible for doing what and when it needs to be accomplished so that you can monitor your progress. And I do believe that's all I have for now. I'm available. Our contact information is included. There I am. Please never, ever, ever hesitate to call me. It's always my honor to be able to work with you. Allison?
Thank you so much, Pamela. I appreciate that. Thanks for rolling with the technology, and I think that was great overview. As Pamela mentioned, as I hope I mentioned at the beginning, this is all just, we know, very brief, but we have lots of this kind of material available for more in-depth conversations and more personalized to kind of what you're doing and what you need to accomplish. So now I'm going to turn it over to Michelle Vartro, who is going to talk about your recruitment and retention plan and process and some of the big things you want to look at to get maximum impact. So Michelle, I hopefully have given you mouse control. Feel free to jump in now.
Okay, thank you, Allison. I'm going to mirror quite a bit of what Pamela said. I'm going to talk to you today about recruitment and retention, and with that, I'm going to talk about it in a 15-step process. It's important to remember that recruitment and retention are not two separate processes, but really one process, and we've broken that out into 4 different parts. And so in the first part, we're talking about planning and preparation. And right off the bat, this assess the need is a lot of what Pamela just discussed in the strategic planning. You're getting your roadmap. You're going to determine, your potential income based on CPT codes and average charge, and then you're going to determine your supply and demand. You're going to look at your provider, your service area. You're going to look at your HPSA scores. All of these things need to be assessed. I will tell you just briefly, I was an HR director for an FQHC, and we actually received 330 funding, new access point funding, for twice. So I've been in your shoes, and again, I want to echo Allison and Pamela's and congratulations. That is such a great thing, and it's a good venture that you're heading out on. So I understand kind of where you're coming from, and one of the things I'm going to talk to you a little bit is I will be talking as if you're a brand new person, but also hopefully for those of you that are already established, giving you some additional ideas as well. So the second piece of assessing the need is also defining kind of your whole practice. What are you looking for? What specialty are you looking for? What are they board certified? Do you need experience versus new grad? What level? Also, where and when services will be provided, the hours, your coverage arrangements, the size of the facility, the technology available. These are all things that you would be looking at when you're assessing just your need. The second piece of that, or the second step that we talk about, and again, I'm reflecting Pamela a little bit here, and then you're gaining support from your community, from your key stakeholders. And the community is a huge piece of this puzzle. And I talk about community a lot in this 15-step process. You're going to discuss, of course, with your staff, your medical staff, but you also want to look at your community's interest in a new provider or even any of your staff. You need to look to the community as well. You've got to begin building a patient base for that provider if that's what you're recruiting for. And then, of course, making any new person feel welcome through the community. The next step is forming a recruitment and retention committee. This is where we talk about this step a lot, in that this is where you do get your community involved, and your recruitment team is key. And it could be one person in charge of everything, but not one person is doing all this. So you need to look to your community, to your board of directors, to your civic leaders, to the real estate agents, to your chamber of commerce, to other physicians in the area, other healthcare people. You need to make it a team effort. The next step in there is defining your opportunity. And this is the one, again, when you're defining your opportunity, I want to just take a minute and talk about, we have a tool that we call the community factors piece. It's based on an APGAR model. And just briefly, I'm not going to go into detail about it, but it's based on 5 factors. So you would look at your community as a whole, and you would assess it on geographic factors, economic, scope of practice, medical support, and then, of course, hospital and community support. And what this does is you assess your community and your facility for strengths and weaknesses, and then trying to create unique selling points out of that to help you with your recruitment. And So for example, like it's basically a geographic factor. You're in rural America, shopping is such a pain. The closest place to go shopping would be 2 or 3 hours away. And so you see that as a weakness in your community. So to counter that, you would buy all of your staff an Amazon Prime membership. And you would, for that small amount a year, then they could get anything they want shipped to them within 2 days. So it's kind of looking at that and assessing your strengths and weaknesses and trying to build out of that. Also, when you're defining your opportunity, you're also looking into yourself. What are you offering as far as benefits, both tangible and intangible? The next section, of course, the next step is defining your candidate. And again, we've talked about that a little bit. Where are you? What do you think professionally and personally would be a good background? Part of the biggest piece to me for retention is recruiting the right person to begin with. So you need to have a really good picture in your mind of what would fit in to your specific needs. And then last, of course, is doing a recruiting budget. Remember to keep into that you're going to, you have your promotion and publicity, your direct market, all of those costs, your candidate screening, your site visit, and then even the time that you're taking away for personnel to interview. Those are all things to keep in mind about your recruitment budget. So part 2, searching for candidates, it gets its one step because this is quite a doozy. Some of the things that I like to point out about this is make sure that you are using all of your sources available. Allison had talked earlier about leveraging your relationships. So make sure you're reaching out to your PCA, to your PCOs, your AHACs, all of these, reaching out to your residential colleges, programs, finding your particular niche of kind of a pipeline, if you will, and also what Pamela said, growing your own. That is just a great way to make sure that you're getting the right candidate back to you. The other thing that I want to talk a little bit about that I think sometimes gets missed is creating your own marketing materials. So make sure that you are developing like a job posting for electronic, social media, and print ads. You're developing promotional products based on the practice opportunity itself, and then also highlighting professional and personal aspects of your community that maybe you've gained out of that factors or out of a strategic planning process. Again, I'm going to be going through this pretty fast. This is a pretty big subject to be going through, so if you have any questions, just let me know. This part, the screening of the candidates, it's kind of self-explanatory. To develop interview guidelines and questions, and also if you're new to this type of thing, I would do some actual like role playing with the people that are going to be in the interview and make sure that they're comfortable with interviewing, and that you have some questions kind of set up beforehand. The next one is, of course, doing your credentialing check. There's a number of steps behind that. Make sure that you're including all your references, at least 2 not provided by the providers. It's always good to have that kind of information. You're going to want to interview the spouse, significant other, and find out their take on the move, on the location, those kind of things. On conducting a creative site visit, make sure that it's creative, but it's also honest. You want to make sure that they have a true understanding of what they're walking into, so that when they make a commitment to you, they're making a commitment to the real you. The last part that we're going to go over is follow up and follow through. So you're going to do your follow-up communication. Once you've gotten to the point where you've selected the candidate, you've talked to them, they're the one that you want, you're going to begin your negotiations and do the contract, conduct the negotiations, and then execute it, and then start in with the actual hiring. And I want to take a minute to talk about onboarding. When you onboard someone, it really makes a difference. Like, that's kind of the very first the chance you get to make a very first impression with them. So take the extra time to make sure that, you know, if their workstation is set up, their computer is ordered, if you're offering uniforms or a lab coat, that it's done and it's ready, business cards, they're already there, and everything is lined up so that they feel the most welcome when they start right from the get-go. The last piece is the retention plan implementation. So this is a piece I want to talk about just a little bit longer. There's a number of steps to do here. So it's not just you hire them, you've got them on board, and then you go. No, you need to keep the person engaged. So you're going to create a schedule to meet with the new provider on a monthly, bi-monthly, quarterly basis, whatever works for you and them. You need to continue to talk with the spouse and the family about integration, how it's working, how they're fitting in with the community, are they finding everything they need. Meet with all the providers and all the staff to discuss on a quarterly basis retention issues and address them as they come up. Conduct a provider and employee staff satisfaction survey, and in addition to doing the survey, do an action plan and follow-up steps based on the results of that survey. Develop a long-range development plan, work with the staff to develop that, and identify potential barriers and address them. For example, excessive call and coverage schedule, physician burnout, lack of resources, all of those kind of things. And that's kind of all I have. I do have, in the slides included, you can find your 3RNet member that's within your state specific that has some additional resources like the factors book that we talked about, a recruitment and retention manual at 3RNet that goes into these steps in much more detail, your primary care office, your AHAC, your NOSOR, and then the PCAs. And then I also have listed out here some other resources, but I believe most of these are on Allison's website, that's chcworkforce.org. That is a phenomenal resource for you. I have been on there, and I wish it had been available whenever I was an HR director. And my takeaways: recruitment is a process. Leverage your collaborations. Use these people that are there to help you. Identify and communicate your strengths, your unique selling points is what I call them, USPs, and invest in your challenges. And that's it.
Great, thank you, Michelle. And in terms of presentation, that's all for us today, folks. We left some time here for your questions and concerns. I know we went over kind of high-level things briefly and would love to answer any direct, deeper questions you have about these issues or any other workforce issues that you may be facing. I'm going to put our contact information up here. Here's all three of us, our email addresses. You can, again, you have these in the slides, but you can scribble those down if you have any offline conversations you'd love to throw us. Right now, I will ask Mariah to let us know if there are any questions in the queue.
So far, we do not. Oh, one question did just come in, actually. Is there more in-depth information you can cover on retention?
Sure. I will give Michelle a moment to collect her thoughts. Retention itself is such a really big bucket in terms of all the different things that you can do. We really like to focus on a variety of different things in terms of satisfaction levels, and burnout is a really big issue for clinicians at health centers. Within burnout, there's lots of more in-depth things that we could talk about, you know, looking at kind of, as Michelle mentioned, call schedules and the burden of time away from family. How are you doing your block scheduling so that people have enough time for administrative tasks? How are you offering professional development or other kinds of things that your clinicians are interested in so they can keep growing? So there's a whole range of things to do with retention. If you have more of a specific question, please let us know right now. Michelle maybe has some immediate thoughts, and again, we're available offline if you have a very specific question related to your health center.
And actually, I'll just butt in. This is Pamela for a second because I was having this very conversation this morning with a health center, and they've started offering sabbaticals to their staff. After 5 years, you can take a 3-week sabbatic, and just if you want to, and actually one of my doctors just had this happen, you can either do something educational or just go play tennis or whatever. And that after another 5 or 6 years, there's another opportunity. So really giving folks some real time off as a retention incentive.
Yeah, Pamela, it makes me think of there's a group in Kansas that does this. They specifically recruit mission-driven providers in an aspect that they give them off 8 weeks to go on a specific mission trip every year. And so they have so many providers that were interested in this, like they have more providers wanting to come to them than they actually have openings. And I know the first thing people think is 8 weeks off, oh my goodness, how could we ever schedule that? But it works with them because the other providers, knowing that they're going to get to do the mission work that they want to do, are more than willing to help cover during that time period. So it's thinking of creative ways and kind of outside of the box ways sometimes. Again, if you're really assessing your opportunity and looking at your unique strengths and weaknesses and recruiting to someone that fits those, it may be that you have to change your ideal a little bit of the ideal candidate, but recruiting to fit those, then that helps. And then again, like Allison said, you know, physician burnout's another big one, and there's different projects all over the place for that, like Project Echo's one that comes to mind. On our website, on the 3RNet website, and I think, Allison, you have this in your resource center. If not, I can send it to you. But there's a Midwest Retention Toolkit that helps you go through like an assessment and specific steps to, I believe it was Michigan that put it together, to help you with retaining the current positions that you have. Again, the provider satisfaction surveys are another thing to look at and really delve into and see what you can do to help retain physicians.
Yeah, thank you both. I just want to echo everything you're saying, and really you want to look at kind of who are the specific people at your health center already that you want to keep, and what are their sort of values, and what's going to make an impact for them in terms of their satisfaction with your health center. Kind of what is your health center giving them that no other employment opportunity will, and maybe it's that sabbatical idea, maybe it's the opportunity to teach students. Maybe it's the opportunity to have all their Saturdays free. I mean, kind of what are the values of the people there, and then what kinds of internal processes do you need to build to make sure that people are really happy and getting what they need so that they can really enjoy their work. You know, we all want to enjoy our work and also stay at your health center for a long time. And that goes from your clinicians all the way to all different kinds of staff. Were there any follow-up questions, Mariah?
We did have one question come in asking if you all could elaborate any on strategies for recruiting and retaining younger generations. If you know of any policies or incentives that are helping in your experience.
Thanks. That's a great question. I'll jump in first, and then I'm sure Pamela and Michelle will have exciting things to add. Absolutely, trying to figure out kind of what the values are of the group that you're trying to recruit is always important, especially with the younger clinicians who are maybe new out of residency. Personally, I would say first you want to look at kind of what do you think those values are. New residents people just coming out of residency, for example, if they're physicians, are very cash poor, and so they're really incentivized by opportunities that help them get set up in their new life, and also look at loan repayment. For example, other kinds of clinicians are going to have different kinds of values and things that they're going to need that are going to make a certain organization attractive to them. So the first thing I would say is kind of look at what are the values and the needs of those younger clinicians depending on what clinician type they are. The second thing would be really doing some self-assessment of your own health center to figure out what do you offer that matches those values. You know, if you have younger clinicians who maybe have they're having young children, or, you know, kind of what is their lifestyle leading them to, and how does your community and your health center match up with those things, and how can you market? Maybe you have great water skiing or a great school system. That's really going to be attractive to those young clinicians. Obviously, spousal opportunities are also important. You know, younger clinicians of all kinds tend to also have younger spouses who need to work. It's a different thing than hiring clinicians of all types who are a little bit older and maybe their spouse, you know, has other opportunities. And so looking at the spousal support as well and figuring out how to market the great things about your community that meet the values of those younger clinicians. So I'll stop there before I get away with myself. Pamela or Michelle, did you have anything you wanted to say?
Yeah, again, Allison, you're right on point, like the unique selling points that you can get to cater towards that. I'll go just a little bit different direction, not only what you can offer the younger generation as far as, and Allison was right on about kind of figuring out what their values are, but how you're actually getting them to interact with you to begin with. And we have found, we instituted a mobile app for them to register with our website to be interested in jobs that we have posted. And it's a very simple form. We've gotten away from asking their address and, you know, a whole bunch of information that really isn't needed. All we need now is their name, their login information, and a contact way to contact them. We've gone as simple as that, and then once we've reached them and made contact with them, then that's when we've reached out and asked for the CVs and gotten more in detail. But that initial contact with them needs to just be short and sweet, and so you need to look at a way to the first contact that you have with them, and then also, again, where you are reaching out to find them and what media you're using to find them. And Pamela, do you have anything?
Oh, sorry, I was muted. Nope, I think that you guys have covered it all.
And I did just want to say, I think we had a follow-up question from someone about kind of alleviating the debt situation. There are a variety of different ways to talk about debt. I'm thinking specifically of physicians at this moment, but you know, obviously all different kinds of clinician types have different different kinds of debt. Physicians, there are a number of disciplines that are eligible for National Health Service Corps money. If you don't know what that is, please give it a quick Google. I think it's nhsc.hrsa.gov, and that's a national loan repayment program that's tied to your health professional shortage area score, and I can always go into that in more detail, but that's a federal loan repayment program that's available to a variety of clinician types and depends on kind of the need identified in your area. Many states also have state loan repayment programs. For the most part, your primary care office is going to know about those and how to get involved in those, so that's a great contact for you. We also suggest doing some financial planning with your new clinicians that may have big dollar debt and may have great dollar signs that they're seeing somewhere else in terms of signing bonuses or something, but it's very easy to make your case about your total compensation package if you take the time to, in fact, make your case about the total compensation package. What are all the additional benefits? What would be their monetary value? How can you use financial planning in general, a financial planner in your area? We're working on developing some kind of tool for that you all could use. How can you talk frankly with folks about what their debt is and how working at a health center can not only be affordable for them, but really something that they want in terms of the intangible benefits that you also offer. So we encourage you to think outside of the box a little bit on how to have those conversations with clinicians when you're talking to them. Mariah, any other questions come in?
We haven't seen any come in too recently. If anybody does have a question lingering, something that came up while we've been discussing the last couple of questions here, please feel free to put that into the question box.
Great, thank you. And while we have just a few more minutes, I wanted to ask Pamela if she could say just a few words. Everything that you said was great about the needs assessment and looking at your present staff and staff satisfaction. Where would you recommend that health centers start that strategic planning for their workforce?
I think that yesterday was already too late. So I think particularly for folks who have just received their grant, even if you were already an organization that was providing healthcare services, now is the time to sit down and revisit the needs assessment that you did so that you could get funded, but look at it with the different eye of what are we doing now? We already told the feds in 3 years we're going to be, getting to this point with our patient projections and our volume projections. We need to really sit down now and do an actual action plan about how we're going to get there. And that's that side-by-side of programmatically, what do we need to do? Financially, what do we need to do to be able to support that? And in terms of staffing up appropriately, what do we need to do to be able to get to that point? And I think that particularly with the very acute changes that are going on in most states right now with delivery system reform, delivery system transformation, as well as payment reform, that it's really important to sit down and have that serious look at that plan that you put in. Remember, your proposal to the federal government was not a work of fiction. It actually was a contract. And for the sake of your community and for the sake of your health center, it's important to start right now on those 3 parallel activities to get to where you said you'll be in 3 years.
Great, thank you, Pamela. And I think at this point we have no remaining questions, so just want to say thanks again to everyone for joining us. Congratulations to you. We are here to help you and to serve you as you walk your path in terms of your own strategic planning and building your workforce. Thanks to Pamela and Michelle for all of their guidance and wisdom today. Again, I'll say that the slides are available for download. Again, all of our contact information is there. And we're just here whenever you need us. So please call or email, again, if you have specific questions from today, if you just want to talk generally about what's available, we're here all the time, anytime. So we hope to talk with you soon, and please stay in touch.